Welcome back to the Informed Pregnancy Podcast. I'm your host, Dr. Elliot Berlin, here discussing birth settings and providers with our guests, Janice Sardoy and Dr. Emiliano Chavira. Janice, your first birth was a whirlwind. Just 3 weeks ago, you had your second baby.
Yes.
And you went back to a birthing center.
I did. A different one, but
a different
birthing
one.
Center.
Did you, after your first experience, did you think maybe I should just do this at a hospital?
Not at all.
No.
I personally was not happy in the hospital. From the first moment of getting the epidural from a doctor that told me, oh, did I give up or I couldn't hack it? It was just really, here I am. It just didn't feel right. So when I got pregnant the second time, I looked at my husband and was like, we got to find a birthing center because the sanctuary had closed.
Right.
So I did. I found Del Mar Birthing Center in South Pasadena, and they are amazing. And because I was a hospital transfer the first time, I did have that fear in the back of my mind, like, is that going to happen again? So I was definitely comforted when I was told Huntington Hospital was 5 minutes away.
Mm-hmm.
Just to know that, because I believe that is there for emergencies, hospitals.
Yeah.
For when you're in labor, an emergency, like we just talked about, comes up. That's what the hospitals are there for. That's what those doctors are there for. And that is my belief. I know I have friends that they're like, nope, I feel safer in the hospital and I want to be in that setting. And to each his own. For me, I think it's empowering to just feel safe in that moment. For me personally, I feel safer with midwives and the people that I invite to be in that moment. But every woman's different, so.
How did your second labor start?
At home, at 1 a.m, woke me up in bed, and my husband was right next to me. I was like, okay, cool, this is happening. And it was very calming, I guess, because I already did it, and I knew what to expect in a sense. Every time is definitely unique and different, but I did it once, and I'm alive, and my child's healthy and happy, so I was like, I can do this. So it was fine, and I did most of my labor at home. I had the same doula. She's amazing. She came around 8, 9 in the morning and just started assisting me, helping me. And my husband had to go to work, so he's like, I'll be right back, I promise. I was like, you can't promise that. What if I have this baby and you're not here? But he did come back, and we did a little bit more. Around 5 p.m., we ended up going to the center, to the Del Mar Birthing Center, which is only 15 minutes away from where I live, thank God. And
what made you go at that point?
My doula, she was pretty much kind of like the coach there. She was definitely
like
leading the pack.
Because if you go too early, they'll send you back home.
Yes, and I was not. No, that's so uncomfortable. It didn't happen to me, but I've heard it happen. So she knew. She's an amazing doula. She has experience. She's been doing it for a while. So, and she also knows me. She was with me my first. So she's like, okay, we're ready. Let's do this. And she called my midwives and let them know we're on our way. And at 1 a.m, so it was a 24-hour labor, he was there. And so I did most
That's
of the
so
day
quick.
at home. Yeah, compared to the 4-day, right? So most of it at home, and then the nighttime with the midwives at the center. And he came at 1 a.m, so it was about a 24-hour.
Did they check your cervix when you got there?
They did, and I believe I was really in and out at that point.
Mm-hmm.
I think they said, I don't remember. I think I was at like 5 or 6. I can't remember.
Did labor get intense for you? You're so calm about it. I just wondered, did you struggle with it at all?
I did. I actually had a moment where I was like, I can't do this. I said it out loud. And my midwives, my doula, my mother, and my best friends that were in the room, and my husband, they were like, yes, you can. But with such confidence. And that's why I chose those people to be there. And I was like, oh, yeah, that's right. I can do this. And so I did. But I did have that moment. And I did do the nitrous. I'm not going to say I didn't.
Outside, yeah. It's good to have in case you need dental work in the middle of, 7 centimeters.
What happened right after that moment when you said you couldn't anymore? Then what came next? I'm curious.
Actually, I was pushing. It was that, and it's funny, my midwives, because the first time since I had the epidural, I didn't feel much of anything around that time during pushing and things like that. I could push, and I did have a vaginal birth, but I didn't feel anything, and my midwives knew that, so they said, okay, you're going to feel the ring of fire, And I was like, what? What are you talking about, the ring of fire? And I did. I felt just that. I felt like a fire, but it wasn't anything I couldn't do or was going to die. It just felt that way. And I was like, oh, wow, that's what they're talking about. That makes sense. I didn't feel that the first time because I was, drugged up. So
So you were happier feeling the ring of fire?
I personally was.
Yeah.
I thought it was so cool. Like, oh, okay, they said I was going to feel this. This is what I'm feeling. This is what it feels like. And it's that moment where, okay, I'm about to meet my baby. So for me, it was very exciting, but I'm a very hippie gypsy girl. So
Because you can feel more, did it feel more like an active participation on your part?
that, and it also felt like I'm in charge of me and my body, and I'm very in tune and aware. I know what's going on. I felt very disempowered with the epidural. I didn't know what was going on. I was being told when to push, when not to push. I couldn't feel much of anything. So for me, that felt, it just didn't feel good for me.
At the birth center, was there no coaching on your pushing? You just push when you felt like
There
it?
was definitely coaching, but it was kind of like this, we were all one in a sense, because what they were telling me made sense to me.
You can feel it.
I can feel it, yes. And funny enough, I have a little theory. This is my personal theory. I didn't tear at all with this birth, and with my first I did. And I personally believe that when you can't feel down there and you're pushing so hard, even though they're telling you when to push and when not to push, you're just like going all crazy. I feel like, yes, you're more likely to tear because you have no feeling and sensation or kind of control, versus when I had no drugs, no epidural, I knew exactly what was going on down there. I knew my body. I knew when to stop. Even though I was being coached, I also was making the decision, when to back off, when to not at that same time. So it's my theory. I could be completely wrong, and it's very out there, but I think that you're less likely to tear.
Is there data on that you know?
Absolutely.
Huh.
So one thing that makes it a little bit complicated is, in general, you see a lot less tears on the second pregnancy than the first. So there's that. But on the other hand, if you look at the American College of OBGYN committee opinion on home birth versus hospital, they have a table that goes through some of the statistics about different complications of pregnancy and the incidence, home versus hospital. And so one of the things that's very clear is the incidence of significant perineal tears is lower in home births.
Interesting.
And then I think, just on a conceptual...
What about in the hospital, medicated versus unmedicated?
I don't know if I've seen that.
Curious.
That would be interesting.
But yeah, I mean, there may be something on that out there that I'm just, not familiar with. But I think the concept that you're talking about is, I've come to appreciate in the last several years, where I've had a lot more interaction with midwives and conversations with them, the notion that mom can feel baby passing through the birth canal, and she responds to what she's feeling intuitively in order to assist, the baby to pass through the birth canal. And mom and baby are kind of doing this dance together. That's just very old midwife knowledge that for us OBs, it's totally foreign, because we don't talk about that during our training. And it's just kind of a thing that we're not really attuned
it's like
to.
An old wives' tale.
Yeah, but I think I think there probably really is something to what you're saying, for sure.
You mentioned, Dr. Chavira, at the beginning that there are certain births that would not be appropriate in your mind to have outside of a hospital. What are some of those?
Well, it probably depends on who you ask. There are midwife organizations that actually have, published criteria, and I'm not totally familiar with those, since that's not my practice. I'm not a midwife. But there's certain things like you're not going to have a preemie baby at home. And so probably you're limiting to something like 36, 37 weeks or beyond. Conditions where there's significant birth defects in the baby, and you're expecting the baby's going to need some kind of specific care at the time of birth. So we're talking about, well-formed, normal full-term baby. Usually the mom does not have significant medical complications like, really severe diabetes. A lot of times milder forms of gestational diabetes, there's kind of a fudge factor there.
Mm-hmm.
She's not going to have, real bad hypertension, cardiac disease, heart disease, kidney disease. She's sort of basically a healthy mom, a full-term, normal baby, which is the majority of pregnancies, right?
Or the healthy.
Yeah. So in the end, probably most women would be candidates for home birth. But I think if we ever have a conversation with us about a midwife, they could be a lot more specific.
I'm sure. I was just curious in your mind if there are certain things that you would rather see at a hospital. What are some of the reasons that people, Janice transferred because it sounds like mostly exhaustion with your first pregnancy. What are some of the reasons that people transfer care? Because they transfer sometimes to you, right? A person will be laboring at home with their midwife and they come into you. What are some of the reasons that would happen?
So that's a real common one.
Exhaustion.
That for whatever reason, the labor's on a very slow trajectory. Mom's just getting really pooped out. Usually she's days into it. Most of the time, mom is, there's this sort of the OB's nightmare of, everything is going to heck and
Train wreck
and but most of the time mom is in perfectly good condition, baby's in perfectly good condition. They're just tired. Very often we will do an epidural and get mom some rest.
Can you turn that down later if she wants to feel pushing?
You can. And some moms are interested in doing that. Some moms are, have become very worn down and the degree of pain has become something overwhelming for them and they don't want it to come back. So that's kind of an individualized thing. I have had patients be transferred to me because they're starting to have high blood pressure. And so they see that. I've had cases where there was some concern about the fetal heart rate and the baby so they transfer into the hospital. But usually the circumstances are very, very stable. It's not actually an emergency that brings them in. It's, there's some feature going on and the mom and her midwife have a conversation about it and they decide mutually that they want to move over to the hospital and they do so. Vast majority of the time, we end up with a vaginal birth.
Are there things that would cause a transfer after the birth?
Yeah.
That can't be handled at home?
Sure. There could be maybe a significant tear that's going to be very painful or very difficult to repair at home. So sometimes moms will come in for a repair of a vaginal tear. There could be issues with bleeding, where maybe the feeling is mom might need a blood transfusion or be evaluated for a blood transfusion, so she may come in for that. There could be a transfer because maybe the baby is looking like the baby needs some help after birth, maybe struggling to breathe or some other issues, and they want to bring the baby in for evaluation or support. So there could be a whole host of reasons to transfer after the birth.
I remember when we had our home birth, the midwives, one thing that was surprising to me was how many duffel bags of stuff the midwives brought in. It almost felt like an episode of MASH. There was just more and more and more, and they all laid it out very neatly and it was ready. They ended up not using anything except gauze pads, really. But they seem to be prepared to deal with a lot of urgency at home should it arise.
Absolutely.
Mm-hmm.
And to stabilize things before transferring in those situations. Out of all the home births I've attended, I can only think of one actual emergency that we transported to the hospital for very quickly. Everything else, every other transport was, as you said, mom's exhausted, not really progressing that well. She wants an epidural. At that point, the pain is overtaking her, becoming more of a suffering than a pain. Things like that.
Yeah.
Have you attended home birth ever?
I have not attended home births. I've witnessed some home births that were being attended by
not attended
experts.
as a physician, but you've been in a birth at home
Right.
as an observer.
Right.
Is it something that, obstetricians, medical doctors can, within their scope of practice at home, although the ACOG seems to come out against it as often as possible, not even for doctors attending home birth, but for people even having home birth. Does this still tap into that early 1900 tug-of-war between midwives and obstetricians?
I have perceived an evolution in the statement that comes from ACOG. And it seems to be changing over time, and it's not quite as staunchly oppositional as it was initially. So my recollection of the ACOG committee opinion on home birth was that it used to say basically something like, we support the right of any woman to make an autonomous decision about where she wants to have her baby. However, we believe that the safest place to give birth is in the hospital. And I will never forget the initial committee opinion cited that the rationale for this was that there's something like a twofold risk of the baby dying in a home birth compared to the hospital birth. Now, when you look at the absolute risk, we've talked about that before, it was a difference of like 4 out of 1,000 versus 2 out of 1,000. And there was zero mention whatsoever about the fact that the C-section rate for moms having a home birth was something in the range of 5%. And moms who are having a hospital birth, it was like 25%. So there was a 5-fold increase in risk to the mother of having a cesarean delivery. And this was just not even mentioned in the committee opinion. So there was kind of like turning a blind eye.
Which, among other things, means if she's going to have more babies, then her subsequent pregnancies are going to be more risky.
Absolutely.
Than had she not had that cesarean.
So over time, this committee opinion has really been changing. And the most recent one, it's a very interesting read. And I think it's much more balanced. And they do talk about the risks of interventions in the hospital, and they talk about it's much more nuanced about that the safety of home birth is going to vary depending on a lot of factors, depending on the skill of the attendant, the inherent characteristics of the mother and whether she has certain high risk features, the distance of the location of the home birth to the nearest hospital, and what's going to be the transport time in the case of emergency. They get into another issue, they sort of touch on it, which is the notion of the integration of the system. So for example, in Europe, there's certain countries where the notion of home birth, it's just built into the system. They have a seamless transport from home to the hospital and sort of accept it. And so there's open communication between the home birth providers and the hospital providers, and it's very seamless, almost like if you're transferring within the hospital from the labor room into the OR because that was needed, you might be transferring from home into the hospital because that is needed. In the United States, it's never been an integrated system, and there in certain settings, and I'm not saying this is rare, this is probably very common, there's a very strong bias against home birth. So when the transport happens from home birth to the hospital, they're met with a very negative response.
Yes.
And I've even heard of cases where the receiving team doesn't even want to hear the report from the home birth attending. I do not want you to open your mouth. I don't want to hear what you have to say. So there's a complete fracture of the care from one setting to the other. And that's something that makes it incredibly unsafe when you don't have, collaboration from the home birth to the hospital birth.
On many levels.
So on many levels. So that's something that could make a home birth safer if there's better integration from one level to the next. And it makes it more dangerous if the specific setting you're in, you can't count on that. So I think the current ACOG committee opinion is much more nuanced and less, I think, dogmatic and imbalanced compared to some of their older statements. So I think we're sort of seeing before our very eyes an evolution in, the point of view.
And also, home birth, out of hospital birth in general, is on the rise. More women are choosing to do it, and their partners are choosing to do it. There's more midwives, more birthing centers popping up all over the place. And I also see, I think, from the younger crowd of doctors, more of an openness to their clients, their patients who want to do it. Maybe not officially backing up their midwives, but at least open to doing co-care or being available for transport, should they get called, as long as they were not told it was going to be a home birth.
And you just reminded me of another very interesting feature of the ACOG committee opinion on home birth. So I quoted to you what they used to say, that we believe the safest place to give birth is the hospital. The current statement says we believe the safest place to give birth is in a hospital or accredited birth center.
Oh.
Mm-hmm.
Now, that term birth center is very interesting because it's a little bit of a murky term. There's a lot of hospitals that use the term birth center, and you're really referring to a hospital setting.
Right.
Wow.
But they didn't say hospital. They didn't say birth centers within hospitals. They said accredited birth centers.
Okay.
And there are definitely freestanding
Accredited
birth centers that are outside of the hospital. So they've all of a sudden, in their most recent committee opinion, lumped in accredited birth centers as, one of the safest places to give birth.
But that is a more open-minded
I would
statement.
say so, definitely.
Yeah.
Right. So things are kind of changing.
Hey.
Slowly, gradually.
I do have this thought based on just working with a lot of people who have to make this choice, that I think that some people feel much safer at a hospital for whatever reason. And I think it's probably the best place for them to give birth if that's where they really feel safe, and they don't feel safe out of a hospital. And some people feel so much safer out of a hospital and don't feel safe at a hospital. And with those people who don't feel safe at a hospital and choose to have the baby there anyway, I have so many experiences where we're doing amazing at home with labor, and then for just magic, we just arrive to the hospital and everything starts to slow down and become more complicated. So I think, ACOG says the safest place to give birth. I think you also have to take into account how somebody feels about the setting that they're in or the providers who they're with. That's my little final thought. Do you guys have any final thoughts?
Absolutely. I think in obstetrics, we very often ask questions that are not interesting. And so in this case, the example of the not interesting question is, which is safer, hospital birth or home birth? It is the boringest question you could possibly ask. Because we are never because neither one is ever going to disappear. We're never going to get to a place in society where nobody gives birth at home, and we don't have birth centers, and that's always going to exist. And we're never going to get to a place where birth moves completely into the home and birth centers, and we don't have hospital births. We're always going to have both. So to me, the interesting question is, how do we make hospital birth safer? Because that's certainly a problem in our society that needs to be worked on. There are plenty of risks that a mother and baby faces in a hospital and complications that can happen as a result of her care. So how do we make hospital birth safer? And simultaneously, how do we make home birth safer? Training midwives, integrating home births into the larger maternity care structure, and having good seamless communication between, home birth and hospital settings when that needs to happen. So how do we make both of them safer? I think that's the much more interesting question.
When you see that happen, when you're at a home birth with someone who has a really good plan for transfer should it be necessary, it's so much more comfortable. It takes off so much of the pressure of not having that, and then forcing yourself to stay home even when you don't want to anymore, or where you're not sure that you should anymore. So on so many levels, what you're saying, I think, will make both of them more both safer and also more supported and enjoyable experiences.
Just to chime in on that, my first was at Good Samaritan. At the time, they had the certified nurse midwives there on staff. And I think that, one, made me feel comfortable. And two, I don't know what their numbers are at that time, if they had more C-sections or not. But I think having nurse midwives on staff can definitely help with all of that. As far as, trying to do it naturally and being open-minded to that route instead of always just like, okay, emergency C-section or C-section. So I heard that they no longer have them. I'm not sure why or what happened, but I think at the time.
At that particular hospital.
Yeah, at Good Samaritan. I think at the time it was such a great thing that they had them on staff and they were there, and it was just a part of the birthing experience there. So I don't know if more hospitals would do that or be open to that, because I think that would help.
I think it's a fact
Absolutely.
that there are births that took place at home that would have ended better at a hospital, and births that took place at a hospital that would have ended better at home. My sort of take-home message is that for most people, two very safe options with different pros and cons and different risks and benefits. And like everything else in this genre, you have to do your homework and find out what decisions you want to make, what benefits and risks are the ones that you want to take, because ultimately it is your body, it is your baby and your experience, and none of us can make those decisions for you.
Right.
Where can we find you guys online? Oh, right. Janice, you're on Twitter at Janice's, but it's really just Janice S.
Yes.
And on Facebook, Janice Sardoy, and on Instagram, which is my favorite, Janice's Pieces. Because it reminds me of one of my favorite foods. I won't say which one. Dr. Chavira, where can we find you online?
I'm kind of old school about the whole social media thing. So I have a MySpace page.
Do you really?
No way.
I'm just kidding. I did make one advance beyond MySpace. I have a Facebook page.
Ooh.
Where I put some little birth stories, and apart from that, mostly links to your podcast.
Oh, amazing.
Nice.
I highly recommend your page.
Yeah, so it's so it's Emiliano Chavira, MD, MPH, FACOG.
Nice.
And by the time you're done typing that in, you're asleep.
.com.
Well, you have a new follower. I'll do it.
I'm on there. All right. Thanks a lot for being here, you guys. Always an interesting conversation. If you have a topic you'd like us to discuss, just send us an email at info@informedpregnancy.com.